back to the Dr. R Show. Dr. Stewart Thomas is back with us talking about sinusitis. Welcome back.
Thank you. Thank you.
When should you treat acute sinusitis and how?
Well, and so it depends on the duration. And so for sinusitis that has been present, or for the symptoms that we mentioned before, that has been present for less than 10 days, really nothing needs to be done. Or what you do is supportive. And so classically this would include analgesia, some sort of pain medication like Motrin or Advil. Decongestants are helpful, and you can take them orally, Sudafed, if there's no reason for you not to. There are some people that shouldn't be taking Sudafed.
What if you have high temperature, high fever during that first 8 days?
You know, that's a very, very good question. I still would tend to believe that it's most likely viral. Now, and that is an interesting segue. There are people that probably should be treated sooner, and if you have a high fever and your immune system is not functioning correctly, then I think that would be a good reason to probably start antibiotics.
What if you're diabetic?
Same thing. Anyone whose immune system is, well, if you're a diabetic, and especially if you're brittle or not well controlled, I think you could make a strong argument for starting on antibiotics sooner than later.
What about if the pain is extreme?
Well, and it can be, even with these viral sinusitis episodes, but we don't think there's any benefit to using an antibiotic in that situation. So we'd still stick with all the conservative measures instead. And if you have a normal, functioning, healthy immune system, and most of us do, thankfully, then it should clear on its own. And more to the point, there's really no benefit of using antibiotics in that situation. In fact, I would argue, and I think that the American Academy of Otolaryngology and Pediatrics and the Family Practice Group all believe that we are prescribing too many antibiotics for this, for episodes of viral sinusitis that would most likely clear on their own.
So for the first 10 days, you would just do supportive care?
Yes.
No antibiotics?
That's right, barring any of those complicating factors that we just mentioned. But then if the symptoms persist beyond 10 days, at that point we think that it makes sense to go ahead and see your doctor. And then what they will probably do is put you on a broad spectrum antibiotic. Augmentin is the favored one. It's a mixture of amoxicillin and a clavulanic acid, a second drug. For those that are penicillin allergic, there are other alternatives, but the duration of therapy is important. And most would argue it should be at least 10 days. Some would say 14. Some doctors would put you on a nasal steroid spray, intranasal steroids. There's some argument about that. And then in significant cases, we'll sometimes add oral steroids as well.
Now, if you don't treat it, is there anything that could go wrong?
Well, there is, and thankfully it's rare, and again, the neurosurgeons know this as well as we do. By definition, bacterial sinusitis is just that. It's a bacterial infection within the bony bounds or confines of the sinus, but it can spread outside the sinuses, and typically that's what we see when we're talking about a complication. The structure most commonly involved is the eye socket, the orbit, and there's a spectrum of disease from mild inflammation of the skin of the eyelids all the way to a full-blown bacterial abscess in the eye socket, which can cause temporary or permanent blindness.
So now that's acute sinusitis.
That's true.
How do you treat chronic sinusitis? Is treatment different?
It is, and so given our current conception now, chronic sinusitis is a completely different animal from acute sinusitis. Acute sinusitis, again, is swelling causing obstruction and then secondary bacterial infection. Chronic sinusitis is the immune system kind of run amok. The inflammatory process, which is a good thing in normal circumstances, remains unchecked in chronic sinusitis for reasons that we do not understand. And so you get this swelling that we mentioned before as a result of this inflammation. And so the only thing that seems to work consistently for that, and there are exceptions, but are steroids. And so most of these patients, if treated with aggressive oral steroid therapy, can be controlled, but that's not a good long-term option. There are all sorts of significant potential side effects from that. So what we have found is that we can get nearly the same effect by simply irrigating the sinuses with steroid-containing fluid. And this is an oversimplification, and there are different varieties of chronic sinusitis, but in general, topical steroids, and when I say topical, that means applied intranasally, usually we'll dissolve them in saline and flush the sinuses, is the standard of care right now.
Well, thank you, Dr. Thomas, for educating us on this phenomenal topic.
My pleasure. Thank you for having me.
And thank you for watching this edition of the Dr. R Show. Until next time, healthy living and goodbye.
Thank you.